trend, as it's turning, you can never say whether we're going to be at the end more like what has happened in Hubei or in Italy, or we're going to be like many of the countries which had one or few cases and they managed to contain all of that. There are countries that have been able to find the cases, treat them, and got them recovered, and that the numbers have not increased. We are really going to try and aim for that we contain as much as possible and reduce the increase. And obviously it's going to be calling on us to do more than just worrying about the clothes, the protective clothes, but also to talk to communities and ask for their cooperation as we ask them to do certain things. It also means we're going to have to talk to the business, particularly as the employers will have to be actually asked to release people who must go for quarantine. If there are such situations, we need them to have an understanding as well. So there are going to be lots of issues of how we interact that's going to determine how we deal with these particular issues. The issues that you have raised here, we're going to play it by ear. The idea of taking people for one-spot quarantine is possible when you deal with the people who would have come from a place like Wuhan, because we are dealing with a definite period and we know exactly how many people we are going to be then looking at them. But to deal with the whole community out there is going to depend now on a day-to-day basis on how the disease evolves. If you look at what happened in China, which is our reference point at this stage, they found one area where the geographic spread of the disease was actually localized in a particular area. They were able to ask people in that whole area to actually self-quarantine, which basically reduced the risk for the rest of the country. And that approach may well be useful as well if we need to get to that point. But at the moment, we don't have an advice that goes to suggesting that we're going to close down one city or a lockdown in one city or one province like would have happened in China. I think it's important to say we're going to evolve as the disease evolves. We're going to be monitoring and therefore applying the guidelines in the best way that we think is suitable to deal with that particular situation. Thank you.
Okay, we'll take 3, 4, and 5 that I indicated. So we'll start with Wendell.
Hi, I'm Minister Wendell from Reuters. There was a question asked by my colleague. We are pretty keen to find out because we're not sure what the nationality is. Is it a South African or is it an Italian? So if you could please indicate us what the nationality of the person is who's tested positive, we'd greatly appreciate that. If you could just give us a little bit more about the movements of this person. What did he do when he came home? Was he at the convention center in Durban? I mean, if you can just tell us what the fears are, and it is maybe even a numerical figure. You know, he was in contact with hundreds or dozens of other people. I know it's early days, but if you could just give us a sense there, please. The other thing is, do we know if he's by plane from some carrier? Because my understanding is SA does not travel unless directly to what you call it. So that means it's important to find out if he first transferred to OR Tambo and got a connecting flight to Durban, or if he came directly to Durban. If you could give us that information as well. And then finally, there was something that you alluded to in the House, the notion of travel restrictions. Is this something that you would be pushing for, as in let us rather cut down on visits or cut down on travels to Italy or China, or limit a sort of contact with those people? Or would you be advocating that to your cabinet colleagues at Home Affairs and I think it's the co-possible. Thanks.
4. Dave.
Thanks. Thanks, Kay Davis, Eyewitness News. I just need to be just a bit more clear, Minister. I'm not sure whether you're saying that you are going to be looking at putting people into quarantine or whether that's unfeasible, because the situation here is very different to Wuhan. But obviously you're watching Durban. Presumably it's Durban, where this person is from, and that will, am I correct in understanding that that's going to guide you going forward in terms of whether you put people into quarantine or not? Prevention is obviously the key thing, and I just wondered whether you've got any plans for checking at places other than airports. Checks, say, at schools, at hospitals, at taxi ranks. Are these measures in your planning at all? And sports and travel restrictions, are you going to be what are you going to be doing about that in terms of discussions over the next few days? Thanks.
Bulelani, you're fine.
Hi, thanks, Minister. Bulelani from SABC. Just touching on the issue of the flight, have you been able to identify what is the name of the flight that this person was traveling on, as well as the issue raised by whether did it travel through OR Tambo, or was it a direct flight to KZN Durban? And as well as, have you been able to identify the number and where have they traveled into the country? The second question, Minister, is the issue of there was no detection of the coronavirus when it entered the country. Is this a normal occurrence? And just lastly, on the issue of quarantine, as things stand now, you're saying you have 10 facilities. What is the capacity of those facilities and the maximum bed space? Thanks so much.
We'll hand over to the panel and then we'll go to Victoria to check if there's any questions. Next round, Liani.
Can you want to do the panel?
I can.
Okay, you can start. I'll come back.
Okay. So I just wanted to clarify what we mean by quarantine in this context, because I think quarantine can mean a lot of different things to different people. So the definition of quarantine is when we take people who are healthy, who have been potentially exposed to an infectious person, and we separate them from society for a fixed period of time, in this case 14 days, and we monitor them for illness, so that what we call the incubation period can pass, and that's to prevent them, if they've been infected, potentially spreading it on. This case, or this individual, had travelled from Italy into South Africa, and so the people that we will be quarantining are the close contacts of the individual. So we have definitions of what constitutes a close contact, and all of those people will be asked to self-quarantine in their homes for 14 days and be monitored also by our medical staff to make sure that if they get any symptoms, they are rapidly tested. What is very important to understand is that there is no suggestion that coronavirus is spreading widely in the community in South Africa or in the community in KwaZulu-Natal. In the instance of a traveller, really those most at risk are the close contacts. And so at this time, those types of quarantine, which are more for a larger area, would not be considered. But as Minister rightly pointed out, should the situation change, as we've seen in a number of other countries, those types of quarantines, which are also a quarantine but of a larger community, are one of the options that might be considered. But at this time, to the general public of South Africa, there really isn't a risk in terms of this virus spreading in the general community. The other thing I wanted to just respond to is, what are we doing in terms of increasing our sensitivity and our ability to detect cases? And I think there are a number of tools that we can use for this. One of the tools we use is our guidance and our case definitions for testing, so who should be tested. And those of you who are following it will see that we regularly update our case definitions based on the situation globally, and there's two parts to that. One of them is looking at which countries have community transmission and making sure that we test everyone from those high-risk countries. Since last week, we've also expanded our case definition to include testing of any person with a pneumonia of unexplained etiology, even if they haven't travelled. So I think that was really included, again, to increase what we call our sensitivity, so our ability to detect a case should the virus be circulating in the community. Another thing that we're planning to do over the next days is also start testing for the virus on our routine surveillance program. So we have systems in place to monitor respiratory disease, predominantly focused on influenza, but also other types of disease. And these are ongoing platforms that we use to monitor the influenza season. Those platforms are really used to track what's going on with respiratory disease in the community. And so as an additional precautionary measure, we will start to test on those platforms just, again, to increase our sensitivity to be able to detect, what's going on out there and if there is any coronavirus out there. Thanks.
Let me just add that all the private laboratories and the general practitioners in private, they do test. If somebody comes in with upper respiratory tract infection symptoms, they test them up, and they generally test them and exclude what we call common flu, the influenza viruses. And if they realize then they send it to us. So they check generally to see if this is a normal problem of flu. And so in this case, this is what happened. So we pick that up. If they think that it's just a common flu, then of course they can discuss it. But then at least they are aware that there's the next level of support which will come from the public sector. Now, the question that's being asked is the person South African or not South African? Well, I want to start premising the question by saying COVID-19 doesn't really care whether it's South African or Italian. And I'm saying that because I'm worried that we shouldn't pitch the stories in such a way as to suggest that we must be looking for foreigners, we must be looking for non-South Africans, and so on. I think for accuracy, we can't just say that the man is South African, but I'm very concerned that we mustn't start creating a sense that is a foreigner or not a foreigner. So far, foreigners and non-foreigners have been infected, and I think the media should really be sensitive on that issue. The person would have landed in OR Tambo and took another flight to KZN. And right now, what we normally do as the protocol, WHO protocol guides, if you've got someone who would have had an infection or who is suspect or want to test, we actually test those who are in the row in front and rows behind, and we count the number of seats around the individual where, in terms of the scientific probability of infection, a cross-infection, these are the people who are most vulnerable. Then we zoom into those particular ones, and then we take those as high risk. It's not difficult to find out who were those people. So our teams are actually working on that right now. I did say earlier that we, in the interest of transparency, we give you information as it arises and will not be able to answer all the questions. So we can't answer all the questions about who else could have been vulnerable and so on. What we will do, our team right now are busy with this. They will be actually mapping the sitting arrangement in the aircraft and then starting to look at who were the people who were in there. Then they'll do the tracing, the contact tracing. They are fairly well trained on this, so they will do it in terms of the international standards. And we have not put any specific restrictions to anyone. As you will be aware, at the start of all of this COVID-19 outbreak, we were asked whether we are recommending that people must stop traveling to China. And we said no, WHO has not recommended a travel ban or a trade ban. In this instance, we have not condition, and we are not going to be motivating specifically for that. But what it does mean is that we are going to increase vigilance on specific areas. In this case, we are going to be including a number of countries where we think the level of transmission is higher, so that we actually encourage people to self-disclose their whereabouts and their contacts with people who could have been infected in these particular areas. And then we're going to follow the international norms. Once we find that there was any contact, our staff generally will walk into the identified planes which are landing into the country and then go through all the questionnaires and pick up those that the crew would have either spotted as showing signs and symptoms that will require attention, and also look at the questionnaires, and then look at, based on the questionnaires, we'll then go through and take the temperature of each and every person as they sit, and then record those where we're taking individuals for further examinations, and ensure that those who are in the vicinity are actually recorded, so that we are able to get informed that you will be hearing from us, and many of them have actually been receiving calls from us to say, how are you today? Do you have anything, any concern in your health? Do you have any cough, any fever, anything? Is there a reason why you think you need to be seen by a doctor or you need to be tested? And if they say no, then it's fine. We'll keep that process up until the results are out on that particular individual. So we are going to be doing this more intensely on those who would have been associated. But certainly because of that kind of level of exposure, we will then be guided by the WHO guidelines. I think it's also important to make the point that the individual landed on the 1st without any symptoms. And therefore, whatever screening, whether you examine the person, or whether you took their blood, we don't believe you would have found anything if they didn't exhibit any symptoms, as it were. The chances are the individual may not have been as infected at that time. We make that as an assumption based on the scientific experience up to now that maybe we may not have been infective. However, we'll take the precaution to test all the others. So in that case, we are not quite worried that someone could have been found to be positive after they've gone through our system and they've not been detected. That's what the issue about incubation period is all about. It basically says that there is a time where you might have a virus that is not showing symptoms, but there might be times when the same virus, having not shown symptoms, might actually create ill health in you, and therefore that can be detected. We also have seen people who were kind of surprised when we say people will come back through a commercial flight from Japan. We say once you have been tested negative, you are unlikely to be having viral particles in your body that could cause an infection on the person that you come across when you yourself have got no symptoms and your tests are showing negative. Unless new scientific evidence proves us otherwise, we'll follow that as a guide. Now, the question asked about checking schools and taxi ranks and so on. Well, to be honest, there hasn't been coronavirus in any South African school reported, in any taxi rank reported, and all we've had is one person who has been in a country that has actually shown infection a rate that is increasing, and has also shown people in different countries who have been in contact with the citizens there to be positive. So I think we need to focus our attention to the areas that are identified as risk areas. If in the future we have everybody in every town, in every province and so on, we have got coronavirus detected all over, I think then it will be relevant to start looking at those issues around the school. The countries like Italy, who are already talking about closing down the schools, they know what they're dealing with. The rapid spread of the infection in Italy has been noticed. As we look every day and look at the numbers of people who have come from Italy who have infected other people has also been increasing. But it doesn't mean that if we've got one case, we may fail to actually contain the infection arising from those who are associated with it. We can't be able to do that. We have seen how diligent approach and very strong precautionary measures can actually assist. So we will take that approach that we know where the person could have been exposed to the virus. We know those who would have been exposed to him will seal that in a kind of web network that will be able to give us all those that must be checked, and then we move on. So if there's another new case, we also want to do exactly the same. I think what we have learned from China is that speed, decisiveness, and unity of everyone and acting in unison becomes a very important issue. And in this case, we really hope that we will get everyone working with us in dealing with this issue. And I also think that now and again, it becomes a bit of concern if you listen to comments and questions and they already create a sense of underlying suspicion when we're raising an issue and say this is the answer, and then you get the question that suggests underlying question. Everyone begins to start doubting if you create that kind of sense. So I think it's important for us to clarify as much as possible, to ask as much as possible, and to try and keep as close to the line in terms of the factual reports are concerned. And then, as I said, we will keep informing the public whenever there's new information. And a number of issues that you might be raising, there may well be areas where we need to be updating you as we move along. Thank you. Sorry, Deputy Minister.
I think just to add on what the Minister has said, that we're going to have to balance between vigilance and panic. And fortunately, in that regard, we have very good guidance from the World Health Organization and our experts in this regard through the NICD. So, because you see, if you veer more into panic and then start, suggesting, sending health workers all over the show, into churches, taxi ranks, everywhere, you're going to lose the plot. We have a very good guidance through the WHO in terms of when you identify a case, this is how you go about in terms of tracing, people who have been very close. Just to remind ourselves that the manner in which the virus spreads, it's not very different from all of us have had at some stage flu, an influenza-like, illness. And you know that the people who have been in close proximity to yourself, if next to somebody very close proximity, in the home, in the office, working environment, and so on. So it's along the same guidelines. It's just that this particular virus, because it comes from the same family, the only difference is that in terms of when it does complicate, its complications are far worse than the normal influenza virus. But otherwise, in terms of the modus operandi, it's along the same line. So we're going to be following those guidelines in terms of making sure that, based on a case by case, and as the minister has already indicated, that the issue of not detecting at the airport, it's not really a strange smash, because we know already that we have a 14-day incubation, and many people are, even those who may have the virus, some of them, the majority actually, remain without symptoms. If you take 100 people, you would find that close to 90% of them, even though they may have the virus in their blood, will not even develop symptoms forever until the virus is actually out of the blood. So that's the reality. So, and if you do any, there's no symptom, they'll have no fever, they'll have no cough, no chest pain, shortness of breath, anything. So you're going to miss those. And some of those will ultimately, like this particular person, after a few days, beyond the 14 days, develop symptoms, and that's something which we're going to expect. Just the last thing which I also just wanted to add is that we must differentiate between how you manage contacts, which is where the quarantine, I had some questions as if the expectation is that even the contacts will depend on the capacity of our health facilities, how to manage the contacts. That's not the case. The only people who, when we talk about these 10 facilities, the only people who will be taken into any of those facilities will be like this first gentleman who has been tested positive. That's the only person. If you take that, if there's a family of 10, the rest of the 10 members of the family, it's in terms of what the Prof has mentioned, how to monitor quarantine in the family, guidelines, and so on. Only the one who's been tested positive then has to be taken into any of the facilities. I think that distinction is very key in terms of looking at what the facilities we're talking about in the 10 the facilities in all the 9 provinces. What are they meant for?
Capacity of the facility.
No, sorry. I hope we don't do this dialogue. We're just explaining that we don't bring people for quarantine in the hospital. They go for treatment. And therefore, the cases that we will actually have, we will be able to treat in the hospitals. Right now, the numbers, we don't have numbers. So we will actually deal with the question of how many more do we need to treat, depending on how many more new cases we have. Right now, we've got enough capacity to deal with the cases as they arise. We don't have a sense of we're going to be having thousands and thousands of cases that we're going to be dealing with. So I'm not sure if the question does take into account that we at the moment don't have. We're just ready to be able to receive the patients that will come through. So if the numbers were to change and we start getting to deal with thousands of numbers, then of course I think that issue might just be a question that can arise.
Thank you, Minister, for that clarity. I see there were new journalists coming in, so we'll try and split it into 2 more rounds before we close. So, Vianney, is your hand still up? You're fine? Okay, we'll go 1. I'll take new hands. Lindsay, Andy, and then 4, 5.
Sorry, just on a point of information. I'm sorry, I wonder if we can just have people re-identify themselves. Some of us arrived late, so we're getting information from people we are unaware of what their names are or where they're from.
I think you could ask who's that one, then you can identify. And you said you're referring to Twitter again. My name is Joel Mkise. Right. But this one is Professor Cheryl Cohen from NICD. The other lady is Dr. Carrigan McCarthy.
Caroline.
Carrigan. Yes. Sorry, my Zulu is a bit changed. Then, of course, on the other side, we've got Patrick Monesa. And, of course, this one is Dr. Joe Pat.
Okay, thank you, Minister. We'll start with number 1. I've got my count now. So who was number 1? Lula?
Yes. Lula Mamaja, SABC. Minister, do you know for how long this person was in Italy? And also if he was there for business, maybe attending a conference, or was he on vacation? On the person we have been in contact with, your statement is saying that the couple has 2 kids. If they are going to school, they are age-going children, they are attending schools anyway in KZN, and maybe if what's going to happen, if they are attending school, what's going to happen to their peers at school, especially in the class they are at. Thanks.
Number 2.
Sorry, I'm partly covered by Lulama. I just want to know that if it's a self-quarantine, how you protect the family and the children from,
Self-quarantine.
Yeah.
What does it mean? Okay. 3.
Me.
Okay, Andy.
Minister, I'm still not sure what you saying to the sporting bodies that you'll be talking to and the churches that will be traveling over Easter. Can you give us a detail of those talks?
4 and 5. 4. Renee. Microphone.
Oh, I'm sorry. Hi, I'm Renee Delcar from CGTN, China Global Television. I just want to find out the 38-year-old man in KZN. I would assume, can you confirm, is he now being treated at one of the 10 facilities? Somewhere in Durban, perhaps? And if you could spell to us, when you say going forward you will ask people to self-quarantine, what will that look like? Is it like staying in bed when you have the flu? Or must you be isolated, 1 person per room, no family around? Can you explain that to us, please?
5, 4.
Minister Paul from Bloomberg again. Just in terms of funding for all of this, will you or your department be going to National Treasury looking for extra funding, or are you still working on the financial aspects of all of this? Thank you.
Before the panel answers, I just want to check in Pretoria and then ascertain if we're going for the last round. Pretoria, is there anybody there?
Good afternoon, Lisa. There's no one in the Pretoria, so you can continue.
Thank you very much. Okay. Can I take you as part of the last round? Okay. There we go. Over to you, Minister.
I'm just laughing at this gentleman who wants to quarantine himself. Let's start with Maka.
So on the issue of self-quarantine, what it means. So as Prof. Cohen pointed out, quarantine is the separation of a well, asymptomatic individual who is at risk of developing disease because they have been exposed. So self-quarantine is voluntary. In the context of a family situation, self-quarantine would mean maintaining an adequate and safe social distance from family members. The World Health Organization recommends that a person stay outside of a radius of 1 meter from other family members, not share a bed, and this is what the World Health Organization recommends. If possible, sleep in a separate room, and at the first sign of symptoms, seek healthcare and seek testing for COVID disease. Also that the person should not go to work, that they should not go to school, and that they should remain within the confines of their home. Now, you'll appreciate that this is very difficult in the context of a family setup. As it happens in this case, the family members are contacts. Should be under self-quarantine. The children should not go to school over this time period, and all of this has already been communicated with the patient in question. I think that's about it.
I think that's, yeah, I don't know if that.
Okay. Well, the questions, I think the quarantine issues have been kind of dealt with. The question of was the person on business and so on, we can confirm that at the moment we're trying to get into more details. The impression that we got was that it was more of a holiday visit. But we're going to be able to get more of that information. The report we gave you was that they went as a group of 10. It was like they went out on a more of a holiday kind of situation. But we will get more information and we'll be able to share that as it becomes clearer. Obviously, once we say quarantine, the kids can't go to school, and that will be made very very clear. What are we saying to churches and sports bodies? At the moment, we just want to bring the awareness that there might be a situation developing in the country, and therefore we need to work together and get their advices in terms of, if they've got any specific suggestion. We need to first share information with them to say where do we see the risks and what are the suggestions that we might have. We will not be taking decisions for them. At the moment, we don't have any reason to enforce sports bodies. We just need the organizers and the leaders to be aware so that they can take the right decisions. In this case, we will not immediately have basis to ban anything and say stop having this. But it will be different if, for example, we knew that there were so many people who were having the particular virus and it might be affecting church members. We will then obviously then have a clear direction there. I think we should just be aware as well that the law would empower us to be able to enforce certain restrictions if it's in the interest of public health and safety. So at the moment, we are not going to be putting any specific recommendations, bans. We just want to have a consultative approach. They must be aware as we are approaching these particular gatherings that we are watching, we are concerned, and that they must also be vigilant. And in our discussion, we should be able to deal with possibilities of advice in terms of what can be done and so on. We have not at this point even recommended any cancellation of any particular conferences. Those of you who might have noticed in the House, the Minister for Tourism was talking to me because this is one of the issues that we are handling together to look at what's happening all over the world, share the information, we'll then come back and look at what needs to be done. Within the existing budget, we will carry the current implications of the coronavirus. It basically requires some of the basic measures in terms of treating patients and protection of those who are vulnerable and ensuring that we reduce the spread of infection and ensure those who are infected are treated so that their conditions improve. So we don't have yet a basis to go and ask for additional money. Any one person with coronavirus is as sick as anyone else who needs to be treated in the hospital. Up until you start getting the problem, if the numbers rise, as you might have seen in China, or there's new extra cost that has to be incurred, which is outside our usual line function, or beyond what has been budgeted for. That's the time at which we'll start raising the issue at that point. So I think we just remain again vigilant to look at what needs to be done at that point, and then we can approach a treasury. At the moment, we're not going to do so. We will do that if the situation gets out of control. Thank you.
Deputy Minister.
Sorry, Deputy Minister.
Yeah, so thanks. Just maybe just to add a few points on what Minister has already raised. So at this stage, in terms of South Africa's preparedness, we have a preparedness plan that we have put together in close consultation with the World Health Organization. So we haven't seen, at this stage we have, we call it the containment stage. So there's no surge in the number of cases, there's no community transfer. So if we get to that stage, and obviously we will need to look at pandemic preparedness. So we are in, as a global WHO's recommendation, we are in an inter-pandemic stage. So we're doing pandemic preparedness not only for South Africa, but all the countries in Africa are required to do this. So for the containment stage, there's a costed plan we put in place, and as mentioned, the Minister has already alluded, that plan is fully funded and contained with the resources that we already have. If we get to the stage of where we have to have surge capacity, then we will approach the relevant bodies and treasury to see how we can mobilize those resources. The other point I wanted to touch on, I think Business Day raised it earlier, in terms of personal protective equipment. For those hospitals already that we have designated hospitals, we have personal protective equipment for now at this containment stage. We have contingency plans because also the global resources, the global supply of some of these personal protective equipment, as you know, is running short. And we need to be able to rationalize these resources, not only to be able to over-order some of them and then we do not utilize them. For example, during the preparedness stage for Ebola, we realized we had massive surplus of some of these personal protective equipment, and we did not utilize them, and some of them went out of date. So the contingency plan we have for that is, one, we can move some of these personal protective equipment around the country when it's required. Trying to work very closely with partner organizations and with private sector so that when the demand is there and we cannot contain it, we will work very closely with them in terms of mobilizing. Thank you, Minister.
Just before DM comes back, let me just confirm. I actually asked for the numbers, how much of this and that we've got. Gowns, masks, N95 masks, protective clothes, etc., gloves, etc. And we have to keep upping the game so that before we had any case, there was a certain level of stock that we kept. Now that we've got a case, we're upping the stock. So we are actually monitoring that aspect as well. Yeah.
But the only thing I can add is that maybe in relation to the gentleman who had asked earlier about the capacity that, as you explained, in the 10 facilities, they would differ in size because these are isolation wards. Separate, these are each one of these hospitals. Every time, as Dr. Munasa mentioned, whether it was Ebola, whether it was any other threat, each province has to designate isolation wards. So when there is something else, we reactivate them. So on average, for instance, one of the hospitals I know of, they mentioned that they have between 27 and 30 beds which have been kept ready for, equipped and so on. So it will differ from in the 10. So one would say, at this stage, as we said, we're only talking about one confirmed. We would be looking at the capacity from province to province between 20 and 30 beds in the hospital. Some of the bigger ones may be a bit more. So we're looking, obviously, at this stage, one would say way beyond, between 200, 300 spread all over the country. And depending on demand, equipment can be moved around. Patients can also be moved around if for one reason or another, one particular province gets overwhelmed. So that's the state of preparedness. Thanks.
Okay, this will be the last round, Minister, and for those who came in late, take this opportunity if you want to. We'll start with, I think you had your hand up. Okay, 1, Yang, 2.
Can I ask clarity on the question I asked?
Okay.
As we speak.
We'll take you as 3 in your name. Okay? And
It's
then,
about clarity, just a
okay,
short
3 and 4 clarity. Otherwise, we'll do the new ones first.
Thank you, Mark Rowson, working with Renee for CGTN. Just want to get confirmation, those contact persons that you monitor now, am I understanding correctly that until the 15th of March, there's a risk that any one of them could display symptoms? Do you monitor them until that date, for this full 14 days? My second question, Minister, I've heard of at least one country where they've had to actually go and change the legislation to be able to enforce quarantine. Is that something that would be necessary in South Africa? Or I think you may have said in your last answer that we actually do have the legislation in place already, so that should you need to enforce quarantine, you can go ahead and do so. Thank you.
Thank you, Minister. Former Olympian. I'm worried about your cough, sir, but luckily Brenda is senior than me. But you know, sir, these Cape Townians...
Thank you for your concern.
These Cape Townians, you say KZN, they say Durban, you know. And we know it could have been the people in Vryheid, perhaps in Kokstad, perhaps up in Emangus, and perhaps even in Ashburton, who might have caused this problem. Where in KZN are we talking about?
Okay, clarity questions 3, 4, and Gary, did you have a clarity? You did? No, it's okay. Oh, okay. 3, 4.
I just want you to know the gentleman in question, as we speak, is he being treated in hospital or where is he right now?
Sure.
4. Okay, and that's it. We're closing the briefing after this. Thank you. Minister.
That should be
Nice.
Renee, just close your microphone, please.
I think it should suffice just to say it's KwaZulu-Natal for now. We will be giving you more information as we go along. And we have said that the individual is being taken to the hospital for treatment because at the time at the time the test results came, the person was under voluntary quarantine. So we sent a whole team to go and deal with the situation, not only just to deal with the individual, to inform them of what the situation is, to start collecting information about contact tracing, to make sure that we activate the whole issue of all those that could be vulnerable so that you can trace them and test them, and if need be, actually deal with them and so on. So it's a whole process that's evolving right now. I think for now, let's just say this is KwaZulu-Natal. And then with time, we'll then be refining the information and see what is necessary to send across. We just want to make sure also that we get enough information for us to know, but not so much as to create unnecessary panic and misunderstanding in the process.
And then on the question of the contacts, so the contacts will be self-quarantined at home, but medical staff will contact them on a daily basis to monitor them for the presence of any symptoms. Should they have symptoms, they will be rapidly tested to exclude the virus. I think we need to acknowledge that there is a possibility that one of them could have been infected with the virus. That is the reason why we are monitoring them and quarantining them to prevent onward spread. So the whole quarantine process with the monitoring is designed to do exactly that. It's to keep them apart from society and then very quickly detect should they have the infection.
The procedures for quarantine are available on the NICD website under the standard operating procedure or guidelines for coronavirus.
Okay, Minister, before we close, I'd like to give any of the panel members an opportunity. If there's any additions or so forth, we won't be taking any other questions. Okay, the briefing is closed. Thank you, ladies and gentlemen.
Hello, I'm listening.